Okay, so I thought it might be interesting for some of you other CNAs who watch me to hear what a typical day shift on the ortho unit is like. And then, of course, once I start working on my shift next week, which is the night shift, then I'll make another video to talk about the typical shift for night shift on the ortho unit. So basically, I've been training on day shift for about a month, and the shift on day shift starts, well, the shift itself is 7 a.m. to 3:30 p.m. So 7 a.m. you go in, log into the computer, log into Epic, log into the GPS tracking system, which we all have little clips that we have to clip onto our scrubs, and we log into that and it's able to track where we are in the hospital at all times while we are clocked in. Um, it also allows the call lights for whatever patients we are assigned to ring our phones, which we also have to carry on us at all times while we are clocked in. So 7 a.m., you go in, find out which patients you're assigned to. Um, then you would log back into Epic and assign yourself to these patients. And if you've never worked with Epic before, it can be very confusing to someone who is just learning. It definitely has a learning curve to it, but you assign yourself to these patients and then you print out like a sheet, which would be like your assignment sheet or your care plan or whatever you want to call it. Um, for those patients. You can choose what information it puts on there. I have on there their name, their age, their room number, what they're in the hospital for, who their doctor is, who their nurse is, if they have AccuChecks, how often, if they are on isolation, and then I have a blank space so then I can make little notes. Um, then from there, you would get report from the CNAs who are going off shift, and you would go into the rooms, each room that you're assigned to, take the temperature of every patient that you are assigned to, and change the whiteboard information. Like our whiteboards have the doctor's name, the patient's name, the date, the nurse's name, CNA's name, their diagnosis, or what surgical procedure that they had. We also have physical therapy notes because on our unit, physical therapy and occupational therapy work with them every day. Um, and then there's other information like how they move, how they transfer, if they're non-weight bearing, if their weight bearing is tolerated, stuff like that. So after you get the temperatures, then you would go back to the nurse's station, enter all that stuff in Epic. Then you have breakfast, and so do you deliver all the trays around the unit. And after breakfast, I would usually start to pass linens to all of my rooms. Sometimes night shift does what they're supposed to do and does at least one or two baths and linen changes. Sometimes they don't. It also kind of depends on the patient because the patient can refuse. Um, so basically around 8, 8:30, somewhere around there, sometimes a little bit later if you get caught up with different call lights going on, which can happen, I will start passing linens and then after that, once I'm done passing linens, I will go back around to everybody, make sure that they all have ice waters, and then I'll go back around and check and see who's ready to get washed up, and I'll go room by room. And hopefully everybody's ready to get washed up. In an ideal world, everybody would be ready to get washed up, but sometimes they're not. Um, and throughout this whole time, you're answering emergency call lights. Like if somebody has to go to the bathroom, those are considered emergency call lights. And you answer regular call lights as well. We also have staff assist call lights, um, which those are considered emergency call lights. Also, um, you could also be told by the nurse that you are getting post-ops, while you're giving baths and all of this, helping people get ready before therapy comes. And just making sure people are comfortable, making sure that they don't need any pain medicine or anything like that, um, making sure they've got what they need. And you know it's kind of like repetitive because you're constantly going back and forth, but once you get the showers, not showers because nobody on our unit can really shower, they're all baths, mostly bed baths, unless you get them up in the chair, or if they're more independent, or closer to going home or being transferred to an extended care facility, then you can set them up in the bathroom with the little shower chair. We do have showers in the room, but like I said, most people still have surgical dressings on, so they can't get those wet, so they can't actually shower. So we'll set up the shower chair in front of the sink, have a basin full of warm water, and have that next to the sink. And then, keep the sink free so then they can brush their teeth and they can rinse the washcloths and all that. And then basically after that, it's helping physical therapy. Um, Lunchtime comes around 12 and we pass the trays. And usually anytime between 11 and 12:30 is when all the CNAs take their lunches. Obviously you can't all go at once, but it's staggered. And then after lunch, you're basically recording intakes and outputs, I's and O's, refilling puller cares, which are the coolers, the ice packs. You are giving people ice packs if they don't have a puller care. You are, again, checking to make sure that they have fresh ice water. And, of course, you're charting. We have to chart every hour. We split it up between nurses and CNAs, though. Nurses are on the even hours, so they chart on the even hours. CNAs chart on the odd hours because we are supposed to be interacting with our patients every single hour. We do hourly rounding at the hospital. So, while you're checking all this, you're recording I's and O's. Around 1:30 is when I usually do that, because it gives me more time to be able to fill up, puller cares and ice waters and ice packs if people don't have puller cares. We also have like the breakaway heat packs. Some people like those better than ice, but we do a lot more ice packs than heat packs. You make sure that everybody is okay. You empty Foley's, empty Hemovacs. That's pretty much it. And then you're just going through and answering call lights. You can get post-ops between 1:30 and 3:30. You can get a post-op at any time. If you get a post-op, then you have to go set the room up, which means, if they're a hip fracture or a knee fracture or, those types of procedures, we always have to put the overhead trapeze on or whatever, where it's a 3-piece and we have to hook it into the bed and then it comes over the bed and there's something for them to pull themselves up with, so they can help us move them up farther in the bed. 3 p.m. CPMs have to go on. Those are probably the most unpleasant for the patients. Some people really like them. Other people actually just completely hate them. But, the CNAs are supposed to put them on at 3 p.m. when the oncoming shift of CNAs shows up. So then there's 2 CNAs in the room anyways because you're supposed to be giving report at that time. And it's a 2-person job to put someone on the CPM. Because one person has to hold the leg, the other person has to slide the CPM under the leg. And if you don't know what the CPMs are, it is the constant or continuous passive motion. I believe that's what it stands for. For like people who have had knee procedures done, it just, move their leg back and forth, so they get the passive range of motion. And it really does help a lot with people, but it is definitely not the most comfortable experience ever. Um, so that's basically it. Like I said, you are going back and forth and answering call lights. That's a lot of what CNAs do on the ortho shift, on the ortho unit, not the ortho shift. But when you get post-ops, you have to go set up the room. Besides the overhead trapeze, you have to set up like all of the, make sure they have a gait belt in the room. Everybody at our facility is issued a gait belt that goes home with them or goes in the trash. Then you have basin that has a cup, ice water, all of that stuff, soap, lotion, toothpaste, toothbrush, a little spit basin for that. Um, and then, socks and bedpan or urinal, well, both really. And, if you have a female patient, then obviously you wouldn't give her a urinal, you would give her a hat instead. And it's just basically, making sure that they have everything that they need. And when the post-op actually shows up, then you assist the nurse with turning them over to, inspect their skin and everything. And you have to go in and take their temperature and all of that at that time too. But this video is really long. I am sorry that it was so long, but I hope you enjoyed learning what a typical day shift is like on the ortho floor. I think the thing that takes the longest, well, the two things that take the longest, in my opinion, are getting everybody bathed and charting, because Epic is still it's a learning process for me, and I'm still learning it. At the nursing home, we did not use Epic. We did not use anything close to Epic. We used touch screen things on the wall, and Epic is a completely computer run system, where you actually type in everything. So, anyways, I hope you guys enjoyed. If you would like more CNA or nursing related videos, then I will definitely film them for you, and stay tuned for those.